Yes, it's a wonderful opportunity. Again, I'm having wonderful healthcare providers and experts who have really dealt a lot in matters HIV and AIDS, and they have really helped so many people cope with the stigma. Some of them who had lost hope to really rejuvenate or invigorate their love again and their life again, and then take care of their families. Most of them have actually, let me say that most of them have no difficulty nowadays in taking care of their children, in taking care of their husbands or their spouses. And we really have wonderful stories from our experts today. So before we start, we are having Mr. Henry Mumanyi, who is an executive director for Global Healthcare Services. He's a wonderful gentleman who has really done healthcare education for over 17 years in the US. And we have also Madam Roslyn, who has been a nurse for so many years, over 20 years in taking care of AIDS patients. Or let me say, I mean, she really understands a lot about how AIDS patients are supposed to be taken care of. I'm actually reducing the years. It's supposed to be like 25 years today. Thank you so much. So welcome, Mr. Mumanyi. Welcome, Roslyn.
Thank you.
Thank you.
Thank you so much. So, Mr. Mumanyi, let's start with you. And today we are basically focusing on the diaspora. How do people in the diaspora view HIV and AIDS?
Yeah, thank you. Thank you so much, Mr. Kepoto, for this opportunity. As you have heard, my name is Henry Mumanyi. I'm the Executive Director of Global Health Services. We are located here in Brooklyn-Park, and we specialize, or we focus more on area intervention and outreach services on infection diseases and other, related diseases. We have been doing this for the last 17 plus years, and especially in the area of HIV and AIDS. HIV is a virus, and when you are infected, this is where we want to get you as providers. And it's very important that our people need to understand this, because when HIV has not reached the AIDS, you can be treated, and you can, be there. You can live as long as it takes. So that's why we encourage our people to get tested and you know your status. When you get tested and you know your status, you can live as long as it takes, provided you follow your care plan. And I know my sisters want to talk about that in details. So there is stigma which has been associated with the HIV and AIDS, especially in the immigrant community here in the United States. There are so many stereotypes. And first, let me talk about stigma. Stigma is a set of, a negative beliefs which a society or a group of people have towards, a certain, element or practice. For example, if somebody has been infected with HIV and AIDS, they don't want to come out, talk about it, because there are some cultural beliefs, cultural, practices that are associated with. If somebody is HIV positive, you cannot get to marry from that place, or you cannot be married, because they think that, it's a curse. And that one has given us a big problem and a big challenge in our community. But in the last, maybe I can say 5 years, we have made some inroads. Our people now have started to understand that, even if you are a HIV and you get tested and put into services, you are provided with, the medication, and you eat the balanced diet and other things, workouts and other things. You can live as long as it takes, like any normal person. So it is very important that our people understand the concept of HIV and AIDS. Thank you.
Thank you so much. So let's hear from Roslyn on how It has actually been a journey, especially in her healthcare life, and how she managed to take care of her first AIDS patients till today. Go ahead, Roslyn.
Good afternoon, everyone. Thank you so much for welcoming me to the program. My name's, as you have heard, Roslyn Mwenesi, and I've been in healthcare for quite a time, dating back from Kenya since 1998. And this is when HIV was so much in place in Kenya. And I remember taking care of my first HIV patient immediately after graduating in one of the biggest hospitals, and even taking care of my own family members, relatives who are being affected by this disease. And this was a big stigma because people were not coming up and saying what they are suffering from, because if you did, then the society would not want to associate yourself with you. So it was hard to get these patients, it was hard to take care of them, and it was hard to combat this illness. But now we are getting information, we are getting people knowing what they need to do. It's getting better. And we need to continue with this so that people can be able to know and come up and be explained to what HIV and AIDS is. So just to cut the story short, when you get the HIV disease or getting these patients coming to the hospitals or seeking help, when they come, they have the low self-esteem. They feel like they've been neglected. They feel like they don't want to talk about it. But once they start talking about it and seek help, they get help. We have some few rules that we need to follow for these patients. First of all, they need to follow up with their primary doctors, getting diagnosed, getting to know the disease, getting to know their lab works, getting to know the medication that they need to be. So following up with their healthcare to know the right medication, keeping up with the appointments is one of the priority they need to do. Secondly, once they've been on medication and good follow-ups with their doctors, they also need to have a proper nutrition diet. It is key to the getting better or getting to live a normal life. They need to eat a proper nutritional diet. This means they need to have all the groups of food included. They need to have the proteins, they need to have the fruits, they need to have the vitamins, they need to get all the groups included so that their diet is balanced. Then they need also to have well hydration. So they need to drink lots of water, lots of fluids. So all that included is a well-balanced diet. And once they eat this diet, they get to build their immunity. And then they get to live a normal life. So proper doctor's visit, proper medication, proper follow-ups, proper diet is key to this disease prevention and treatment. Then we have to look at the other part of keeping themselves safe. We don't have to be reinfected or infecting other patients, other people that are negative, or other family members or relatives. So they need to know the prevention method of keeping themselves safe and keeping the other people safe. So there's prevention methods that we as the healthcare providers, when they come to us, we can talk to them about the prevention methods that are important and that are key, that they can be able to do so that they can live in the community safe to themselves and to others. And this could include things like using prevention methods like condoms. This could include, even when they're living with their family members, how to not cross-infect the other family members with simple things that they need to do. So HIV and AIDS is a disease that we can be able to manage and live in the society with other people without being fearful. But our society needs to be told, to come out and be explained to this, because our society is living in fear. They tend to neglect and isolate these HIV patients. So that is the main problem we are having in our community, especially here in Minnesota. We have patients that are having this disease that are so isolated and are so left alone. So we need to know a way on how to come up and meet them, get them, and talk to them. The society needs to come up and have these people as a community help them in one way or another. I would end there. If there's any other question, we can discuss again so that we can know how to help them.
Thank you so much. Now, Mr. Henry, from another perspective, I would love you to tell us how you prepare people, how you encourage people to get tested, and the importance, basically the importance of getting tested, and as you have basically put it, early intervention. Go ahead. How do you prepare people to come for testing?
Yeah, thank you so much. I think Madam has really explained it very, very, with the details, and I would like to add something there before I even answer your question, because we have come of late, we have come to understand that sometimes HIV patients, we call it, because they are judgmental themselves first, because nobody knows that you are HIV unless he or she has tested you. Now, you try to avoid other people. That means you have stigmatized yourself already before you are being stigmatized by these other people. So what we encourage people is get tested. When you get tested, it is you who knows that, you know what, this is my status. And then, like Madam has said, and then you follow the care plan. Self-care, you have to eat nice to build your immune system, okay? For your doctor's appointments, you see? And also we have even what we call PrEP, these things are there. The resources are there. The services, it is only that you decide as an individual, this is my status and this is what I want to do. Like Madam has said, you must follow the care plan properly. You have your case manager. Whenever you have any question, he or she can, take you through. And they provide even food and other services. So HIV is not a death sentence. You can live as long as it takes. But the first thing you do, the first step is you get tested. And everybody is a victim. Unless you are tested, nobody's safe. You cannot know somebody's status or your status before you get tested. And once you got tested, now you found that you are infected, then that's where the game starts. So it is important. We want to encourage our people in the community that everybody please get tested earlier. You know your status, and then life starts from there. What was your question, Mr. Gibot, again? Because that's what I wanted to add it.
That is perfectly okay. I mean, you came in with a lot of wonderful, information. So the question I wanted, how do you prepare people to come and get tested? Because most of the people actually fear. Go ahead.
Yes. So this is what we do. We go out there in various places, where some events are. You get time, like 5 minutes, you talk about HIV and AIDS, and you tell them, this is who we are, this is what we do in the community, and whenever you need these services, just come. Then we test you. After that, the process starts from there, based on what is the result or what is the outcome. But again, we encourage them, that we tell them, you know what, it is important. Please come out, get tested, and you know your status. We encourage them. We go to churches, we go to schools, we go to businesses. We use various means of passing the message. For example, now using flyers, online, WhatsApp groups, and various, like Instagram, Facebook, you name it. There are so many ways of passing the message, and we know the targeted audience, especially those ones who are in the streets, the homeless people. We know where they congregate. We normally go there with flyers and everything, and then we engage them, Then we tell them, when we have an event, when you come there are some, gift cards that we give them to entice them or to make them come, So they come. And sometimes we use, various networks like, through friends. And when then that's when we know where they are. Maybe they have got the matches or they're playing some, a match somewhere in the field. Then, you go there, you kind of sponsor that event. Then before and after, you are given time to speak about what you do, and you tell them, this is what we do. Then you invite them to come where you are.
Thank you so much. Thank you so much, Brother Momanyi. So, Rosalina, I need you also to come strongly and really tell us about some of the patients who, when they have really known their status, decide now, they develop some mental problems. How do you handle such a kind of patients?
It depends with the patients, and every case is specific, and not all of them will develop mental illness. We deal with them different case by case. So when you have HIV or HIV disease, and you're not on your medication and you're not getting all the follow-ups, there are so many other diseases or so many other things, because your immunity is low. So you're prone to any kind of infection, any kind of disease, any kind of problem that will come up. And that's why we are still insisting on boosting or making your immunity good, eating well to get your immunity good, so that you avoid all these other complications of diseases that can come up with your low immunity. The mental illness part you're talking about, this is stress induced. The stress that comes up with the HIV through the stigma that my brother has just talked about, that they get themselves first before someone else puts this on them, because they are not accepting it. They are questioning it. They live in denial for so long, and that is a stress. And you know what stress can do to your body. Stress can cause all kinds of diseases, including mental illness, including cancer, including any disease you can think about is stress involved. So if we can bring these stress levels down by accepting, this starts individually. I, as a patient, has to accept that I have this disease. And it's not easy as we are talking. It is hard for them to deal with this. That's why there's psychologists, there's therapists, and all that is included in what we talk about. Follow up with your medical appointments. They have every medical appointment arranged for you. There's a psychologist, there's a therapist, there's a medical provider, there's a nutritionist that you are provided for. And in most cases, when they don't have insurances, there's community-based insurance coverage that can be able to help these patients. This is one of the diseases that the country has taken or put in a lot of funding. So we just want to encourage our people, our community people, to come up, not to be scared about the funding, not to be worried about what will I eat, how will I go about the therapy, because there is help out here. There is money that has been funded in this disease that people need just to know where to go to, where to seek help, and what to do. So there's so many diseases, as you have said, not only mental health, but other complications that can come up if you don't get treatment with this disease.
Thank you so much, Roslyn, for putting some highlights and some punch-ins to ensure that at least people who are infected or affected ensure that they really follow up their medical programs religiously so that they can actually live longer. So this question is going to Brother Momanyi again. Yeah, Brother Momanyi, we have had, there are so many instances, or let me call them instances in the community whereby some members have, have known that they are infected, but now they decide to go and infect other people. Are there any laws associated with that? If you voluntarily infect somebody and you know your status, what does the state do to such a kind of people?
Yeah, thank you so much. Yeah, there are some laws. It's a criminal offense if you find that you are a HIV infected, then you infect somebody intentionally. Yeah, you can be jailed and fined too.
Okay, so there's.
But again,
yes.
Yeah. But again, those people who are infected, when they start, doing that kind of act, number one, we have what we call the infection. And actually, that's the worst. Because when you are HIV infected and you find another person whom maybe you have sex with is infected, you can't survive. You are actually, those are most of the people who die, they die because of reinfection. Okay, because in the first place, it's infected because the immune system is what? Compromised, right? Mm-hmm. So, if your immune system is compromised, then you get infected. There you go. You see. So, you may think that you are trying to spread that, but you are limiting your chances of living. Okay? So, it is important when you are infected, if you want to do sex, you must use protection. It is very important because you are protecting yourself too, even if you are infected. All right? But they have this program which we call it PrEP. Madam knows it very well. That this is a time that, if you are in this program, it's like morning after pill for the ladies, you see, provided you keep what? Consistent in it. You find one person is HIV infected and another one is negative. The couples, but still they can do what? They can have sex without even protection. But you must be consistent with that. If you fail to take that, medication in a day, then you go back again, you start afresh. It is there, and actually, I don't know why our people are not taking advantage of it, because especially people who are infected,
Where do they get them? People are fearing. Where do they get them? Are there resources?
The resources are Lambert. They are everywhere. That's why we are there. We refer you. Once you come to us.
Okay, you need to say a specifics. You need to give. Okay, there is a resource.
Right.
A resource here and there and there.
Yes.
Because you can't walk in the hospital. People may think that you need to be walking. Having like an appointment to go to the hospital. So how does it work out?
So it works like this. We are the providers. We are the people who does the work of HIV AIDS. So if you need that one, then you come and ask Mr. Momanyi. Yeah? This is what I want. All right? For example, now we have these big, clinics. For example, now we have 505. We have the Aliveness Project. Even your doctor, he can tell you, your provider, you are a personal doctor. Tell him that, this is what I need. And actually, that's where you have to start from, because you are a doctor, you have to say exactly what you need. Okay? Yeah, so we are having that program outside here, although it's not now funded that much because of this, what is going on here with the current administration. But that is the next stage that we want to bring it out here. Our people to know that, these are other services which are very important that I can tap into. You see? Yeah, because people don't like, using these other methods of protection. if it is a matter of a bill and you live your life as normal as usual, you take advantage. Okay? Yeah, so we want to encourage our people. The resources are everywhere, especially for those agencies that provide these HIV and AIDS services. We do referrals, especially in my clinic, in my office here, I do screening and testing. And if I find that, you need more, referral, then I send you to these clinics because they are there. I know them where they are. And actually, I drive you there personally because that's how we are trained. I take you there and then I introduce you. I say, I give them the file, they look at the file, and then they take you from there. And there are other services, there are other benefits which are associated with people who have tested and have found that, they are HIV, infected. For example, now, they put you into care. You get your case manager, and then you will process for you the insurance, housing, free meals, even employment process for you. And most of these services are found in the Aliveness project. This is one of the biggest, clinic that or agents that we know that works for, especially all the diverse people from diverse background. And they have got even yoga, massage, anything that you need is there.
Have so many programs.
And they provide you culturally appropriate food that you normally eat. So it is one of the best, places that where you can get this kind of the services. Yeah, so that's why I'm saying we, the providers, we have to come out here, especially this summer, and try to do some, seminars and other things, workshops, you see. For example, now, even if the KDRTV comes there, that's where we do some interviews, we answer some questions, and we encourage people. We give them those kind of, flyers and other things which are what the information they need, so that now they can make their own appointments and go and see whether they can get these services.
Thank you so much. Because of time now, I've got like
even some sub-Saharan Africa,
Okay. Yeah.
is one of the organizations that has been very consistent. I've been working with them for the last 15 plus years, the Aliveness project, especially on the HIV and AIDS. These are the institutions that I've worked with, or we do cooperate, and yearly we provide what we call African World AIDS Day, where all these agencies come together, plus people who are living with HIV and AIDS, they come there and give their testimonies so that other people can learn. And even the faith-based, discharges and other, even the Muslims, they have joined us. We are fighting these things. HIV is not a big challenge because we are allowed to speak from the pulpit, especially in the Seventh-day Adventist Church, which was very, not easy. But now that they are opening their doors, I think we know that we are making progress.
Thank you so much. Yeah. So in the few minutes I'm having, I've got like 3 minutes. So let me give Roslyn 2 minutes so that she can wrap up. She can, whatever, if there's a question I've not asked her, but she needs to share with the world, please go ahead, and then Mani will wrap it up.
I think the main thing we just have to insist on is the campaign that should go on. We should keep talking and letting people know that this is a disease that can be helped with the nutrition, with the medication. This is not a death sentence. This is a disease that can be prevented. For those people who have not been infected, they can keep safe so that they are not infected. So we should keep the campaign going. And maybe next time we have this meeting, now we can involve our young people that need to know that this is not only a disease for the old or the adult. This is a disease that can infect even the young children that we are raising up in this generation, they need to know how to prevent themselves too, so that they don't end up with this disease. So maybe that is the next challenge you should be having, how we are going to approach this topic to our young adult children that are growing in this society.
Thank you so much, Roslyn. So, Mumanyi, we've got only 2 minutes remaining. Please, if you can also wrap it up so that we call it a day. Thank you. Go ahead.
Yeah, I want to be very brief. Yeah, thank you once again, Mr. Kebueto. All I will want to request you is we keep on, providing this kind of space so that we can even invite our people to join, especially even those people who are living with HIV AIDS, to come and give their own testimonies there, because our people now will trust, hey, if this person has been living with HIV for the last 50 years, 40 plus years, and they look very healthy, what is the secret? Those people will talk about it. So I want to commend you so much that since you started, doing this, coming, out and inviting various professionals coming talking about HIV and AIDS, I think we have made some progress.
Thank you.
So we encourage more of this, and even at our counterparts, these professionals in health, field, we want you to invite more of them to come. Some mothers and some fathers, even doctors. We want them to come out and because it is just a corrective endeavor, so that now our people could know that what, this is not a death sentence. You can live as long as it takes, so that now we can move on as a family or as a community. Thank you so much.
Thank you so much. So with that, let's just call it a day today, but we'll continue the discussion. As Roslyn has also advised us or suggested, we'll definitely have to bring in younger people so that they can also have their perspective on this particular pandemic, so that we can fight it together and then reduce the infection in the society. Because as per the Minnesota, let me call it the Minnesota Department of Health, it's alarming that in 2023, the statistics which came out is that the African immigrants or the people of color, their infection rate skyrocketed. So we don't actually want that one to continue. So let's be together, let's fight this scourge so that we can help our people live a better life. And whoever is living or doesn't know that is living with HIV AIDS, the very best thing for you to do, go get tested, know your status, so that you can start plan or care earlier, so that you can live longer. Till next time, thank you very much, Henry. Thank you very much, Roslyn. And
thank you so much. And don't forget to put our number down there for anybody who wants to get our services. They can call us.
Thank you so much. We'll definitely do that. Thank you so much.
Thank you very much.
Welcome.